So here's the truth. I'm tired, but not like the didn't get enough sleep tired, although I have that too. I mean, the kind of exhaustion that feels like it's stitched into your bones. So for me, that's perimenopause. And honestly, also the high doses of GLP-1s haven't helped. And so I kept thinking, am I missing something? And it turns out, yeah, we naturally have NAD in our bodies. It's essential for energy, cellular repair, brain function. But as we age, we lose it, which of course is not fun. No bueno. That's why I've added NAD plus back in, and I've been going through Shed, which is a telehealth to do it, because this season of my life is about putting back what time or meds have taken from me. I'm not ashamed of it. Whether it's GLP-1, HRT, or NAD, I'm rebuilding the energy that I deserve to have. Now, listen, I'm not a doctor and I don't pretend to be one on this podcast. I always recommend checking with your medical provider to see if NAD is right for you. But if you go through Shed, you will meet with a licensed provider to be able to guide you safely. If you're feeling the same bone deep fatigue like I am, check out the NAD Plus with Shed. If you use my code, which is Kim40 at checkout, you're going to save 40%. It's also linked in my link tree. There's no shame in my game, just science support and reclaiming what's mine. I hope it works for you too.
Because we have so many new members to the GLP-1 community, and I find that so many of them, and I think all of us can attest to this, that they're very apprehensive, if not scared, of the side effects of these medications. And, I know that I openly talk about mine only to be transparent, but they're like, I want to start, but I'm really afraid of the side effects. And I and and I know, as probably as a doctor, you hear this also. But my question is, can you talk to us about the side effects, and also, are the side effects usually manageable? So, just to kind of educate
Yeah.
people on this.
Yep. So I think it is important for people to be aware that there are common side effects that get better with time, that are kind of expected because of how the medication works. And so that's always a big discussion that I'll have. People do have to know about the potential side effects. So just with the way that the medication works, with it slowing down gastric emptying, a lot of the side effects are going to go along with that, and they're going to be gastrointestinal related. So I tell people they should expect, to some degree, mild, manageable side effects, at least with starting the medication. That should improve with time. It should be tolerable. If it's not tolerable, then it's not the right medication or it's not the right dose, because it shouldn't be severe. But nausea, heartburn because the food is not leaving your stomach as quickly. So if people eat like close to bed, or even when they normally would eat, that food could still be in their stomach. So they might find that they have to adjust. They can't eat as close to bed. They can't eat certain things that are going to trigger heartburn. They have to eat smaller meals, but people usually will adjust. So heartburn is a big one. Nausea. And nausea usually is the first 2-3 days after an injection, and gets better and does usually improve with time. And we can also make that tolerable by having, like, Zofran on hand is appropriate for most patients. So I will usually offer that when I am starting a medication, and I think it's totally fine to have that on hand, as long as it's not needed like 4 times a day forever and ever. And then constipation is the biggest thing that I see. And I think it's really important for people to stay on top of that. So some people will ignore the constipation until it gets to the point that they're having, bleeding hemorrhoids. And we're like, okay, now what are we going to do? If people kind of expect it, they'll know, like, okay, I need to start Miralax, I need to start magnesium. And there's a lot of different remedies for that work for different people. So like magnesium citrate, and none of this is medical advice, by the way. I'm just going to throw that out here. General
Disclaimer.
Should have done that at the beginning, but yes, all this is educational purposes only. But magnesium citrate can be really good for constipation, especially for people who just aren't going to do powders, because a lot of people just aren't going to do powders. But otherwise, Miralax is great. Fiber is great. I think the little Miralax fiber cocktail is great. I think a lot of people on here do that. But there's a lot of ways. The point being, there are so many different ways that we can manage constipation. And that is the number one side effect that I've seen with Mounjaro, is constipation. But it has not been so severe that anybody has quit Mounjaro. So those would all be common. Less common would be like profuse vomiting. And if that's the case, that if someone on TikTok is talking about that, often that's going to be someone who was put on too high of a dose, so that's more like a doctor error. But it may not be, but profuse vomiting would not be a common side effect. And then the ones that people are typically scared of are pancreatitis, which is not at all a common side effect that we see with GLP meds. It's a common side effect that we see with diabetes and inflamed, angry pancreases. And thyroid cancer is the big one, which there's no good conclusive evidence that these medications cause thyroid cancer unless you're a rat. So as long as people don't have that specific family history or personal history of that medullary thyroid carcinoma or MEN2 syndrome. Medullary thyroid carcinoma is usually genetic as part of MEN2 syndrome, and it's very, very rare. I've still never had a patient who had a family history of medullary thyroid carcinoma. It's that rare. So we usually see papillary thyroid cancer, follicular, some other type. It's rarely medullary thyroid carcinoma. So that's the only true contraindication to these meds, is that particular history or family history because of the rodent studies. So
I do know some rats that masquerade.
Yeah. Like you're related to rats. Yeah, and that's not to say, like, I don't think we can 100% say, like, okay, this is never going to be an issue. It's just that it's really hard for the studies to make that determination because it's such a rare thing anyway. And we have 20 years of data, so they're not brand new, but we don't have 50 years of data. So, is it possible that 20 or 30 years from now, they might say, okay, yes, there's absolutely a small increased risk. I think that's a possibility, but I don't think it's going to be a large risk. And there is a risk of thyroid cancer anyway that is related to obesity. So it's always going to be risk for benefits, and what are the risk of going untreated? What are the risk of untreated obesity and diabetes? And there's like 12, 13 different cancers that are associated with obesity. So we always have to weigh the risk and the benefits, but for most people, the benefits will outweigh the risk.
Okay. And I'm so glad you said that, because that's what I that's what I say, is that the benefit definitely is more than the risk. And another side effect that we're hearing more about is hair loss. And we're seeing it in the media also, of these drugs cause hair loss. And I thought it was rapid weight loss will cause hair loss, not necessarily these medications. Can you explain that and briefly discuss that so we're more educated on it?
Yeah. And as far as I'm aware, I don't believe there is a mechanism by which the medication causes hair loss, at least not that we know of. So we think that's more just related to the stress of, it could be the stress of a new medication on the body. It could be from the stress of the weight loss. And personally, I've not had patients experience hair loss that haven't had a pretty significant weight loss. But we can experience hair loss after any big stress. So it's the same type of hair loss that we see after as a mom, after we give birth. It's 3 to 4 months later we start losing hair, and that can go on for several months, and then it stops, and it feels like it's never going to stop, and you feel like you're going bald. And I feel like I've been there constantly the past few years.
I bet.
I bet.
It comes back, and it usually does.
I guess so.
Does come back. Yeah. So that can definitely happen, but we think that is more related to the rapid or significant weight loss, maybe due to some nutritional deficiencies, which is definitely a possibility. So not getting enough protein, not getting iron, not getting vitamin D. So having those levels checked, like an iron level and a ferritin level, not just blood counts, would be one good thing to do. So thyroid levels, for people who are prone to that. So I still think it deserves a workup, just like anything else, but it's not an unexpected thing. And we don't think it's because of the medication right now. We think it's from just the lack of nutrients, maybe a deficiency, or just the rapid weight loss and the shock to the body.
Gotcha.
And then it usually grows back, you said.
It almost always grows back. So if that were to go on for so long, like say somebody is in a constant state of severe stress can cause that type of hair loss. if you never get out of that stress, then yeah, maybe
Mhm.
it could be a more permanent thing. If you're in a chronic state for many years of iron deficiency, then yeah, maybe those hair follicles aren't going to start regenerating. But yeah,
Yeah.
typically it will reverse. Like, so the idea with the weight loss would be when the rapid weight loss, or that when, once you reach maintenance, we would hope things would level out. I don't
Mhm.
think we've got any good studies on that right now, but
Yeah.
yeah, I'm very hopeful that hair would come back.
Great,
Yeah.
actually, yeah,
But I know it's a big
Thank you.
worry for a lot of people. It's a hard one.
Yes.
month to month, box to box. This is how we live in the GLP-1 community. We never know when our coverage is going to get yanked from underneath us. Last year, it got yanked out from underneath me, and I had to go the compound route. I had to go to a telehealth. And what alleviated that financial burden a little bit for me was using my HSA card. I went to the hsastore.com to look for some electrolytes. ShedRx is there. ShedRx, the telehealth, is HSA approved and FSA approved. Ah! So I'm going to ShedRx, right? And I'm going to use my HSA, which alleviates a huge financial burden for me. And if you're interested as well, go to shedrx.com. They'll take great care of you. They've got fantastic doctors. And you can use the link down below in our link tree, or just go to shedrx.com and use my code, CAT50. Get your $50 off your first month.